Hey guys, today we're going to talk about how you can find out if you're at higher risk of having a stroke. Pretty important stuff. Interest you? Stick around. $600,000 people a year in the United States have their first stroke. Someone has a stroke in the US every 40 seconds, and every 4 minutes somebody dies. So today we're talking about how you can prevent a stroke, and at the end I'm going to tell you how you can get tested like I did to find out if you're at risk of having a stroke. Let's just throw out my disclaimer, I'm not a medical doctor. I'm going to be talking from the perspective of a patient and a nutritionist. So if you have a blood clot and it goes to your heart, that's a heart attack. If you have a blood clot and it goes to your brain or it's formed in your brain, that's a stroke. Here's my story as to why I wanted to get tested to find out if I'm at higher risk of having a stroke. On my mom's side of the family, her father passed away at 61 of a heart attack. He left my grandmother in full retirement to never have a companion. He left grandchildren that he never got to watch grow up, and I never actually got to meet him. He had died before I was born. His son, my mom's brother, he had 2 kids. My mom's brother had a stroke in his late 40s, debilitating. He never walked the same, and that only lasted 4 years, because by the time he was 53, a year younger than I am today, he was gone. So I wanted to make sure that if he had some type of gene that accelerated the rate of clotting in his body, that I wasn't showing the same thing. And I wanted to know. Probably 10 years ago, I was speaking with my primary care, and I asked him, I'd like to have my carotid arteries checked, ultrasound. And he said, why? And I told him the story I just told you. And he said, nah, I'm not going to have the insurance company pay for that. And I said, fair enough. It's about $300 at the time. I'll pay for it myself. Could you please go ahead and order it? And he said, no, I'm not going to do that. He said, typically we wait until you're symptomatic. Symptomatic? Do you know what symptomatic of a stroke is? It's either your face drooping, arm goes numb, or you lose the ability to speak. That's typical modern medicine in the United States. Let's treat the symptoms. Let's not do a damn thing about the prevention. So he wants me to walk in at some point in time and say, hey doc, I think now's the time to have my carotid ultrasound. Come on. Ridiculous. Especially when the technology is there to have it checked and checked cheap. So that's what we're going to talk about today. I also, from my nutritional end of it, I have done a lot of work in formulating fish oil for a couple companies that I've worked with. And in my looking and digging into the studies, I have found that the EPA in the fish oil will pull the non-oxidized LDL off the inside of the blood vessel wall to be sent to the liver to be metabolized. End of story. So if you take fish oil, it should help reduce your risk of the clogging up of the arteries. And I have taken fish oil for almost 20 years, faithfully. Probably nothing else as faithful as fish oil. And I wanted to know, am I doing something right? Am I doing something wrong? Is it helping? Is it not helping? I also had a patient, boy, this is an old story too, it was years ago, come to me. He had donated a kidney to his brother. And after the surgery, the doctor said to him, I don't usually get to see cross sections of blood vessels in living people. He goes, obviously we can see it in people after they pass away. He said, but we were able to take your kidney to give to your brother, and I was able to see the cross-section of your blood vessel. And at 40 years old, or 40-something years old, I think he was, he had next to no plaque in his blood vessel. And he said, why do you think that is? And my patient said, well, It could be because I constantly, every single day for lunch, have a can of sardines. And sardines is rich in omega-3s. And the doctor was like, could be. And that's been in the back of my head as well. So let's get on to how I found out that my carotid arteries are fine. The CDC says we should use a acronym called FAST, meaning you're going to want to get to a doctor fast if you're symptomatic. And the symptoms are facial paralysis, the droop, arm numbness, or speech issues. Those things don't usually go away after the stroke. There's usually permanent damage at some level of a stroke, and we really, really want to make sure we're not going to have one. I found this company called Lifeline. They're out of Austin, Texas. I thought I was going to go to Austin to have the test done until I realized it's a very interesting way in which they do this. They usually will go around to like I used the Knights of Columbus in Westboro here in Massachusetts. They usually do it as a fundraiser to make money for the group. And they ask their members to come in and get tested. It's about $140. And the number of tests that they do that are really things that you can't get done at your primary care's office is interesting. So they did the carotid artery ultrasound. They also looked at my abdomen to see if I was at risk for an abdominal aneurysm, which is another one of those things that you're not usually checked for, and it can kill people instantly as soon as it ruptures. There is no getting to the hospital to get it fixed. You will die. And unfortunately, I know friends and family members who have had them, and it's awful. I mean, it's death. But if you know you have one ahead of time, there's treatment for it. Another thing they did was checking for peripheral artery disease. So they put almost like blood pressure cuffs on both wrists and both feet and compare the feet to the wrists. And the blood pressure at each place should be about the same. If it's not, it's indicative of peripheral artery disease. So they check my carotid arteries. They check both sides with the ultrasound. And they listen to the rate at which the blood flow is going through them. The faster the blood flow, the narrower the vessel. So you don't want narrow vessels. Mine came in normal at somewhere between 11 and 125 centimeters of blood per second. Fortunately for me, my carotid arteries flowing beautifully, absolutely normal. And my risk of an aortic aneurysm was absolutely normal. It was great. But nobody knows. And even just to have this done once is amazing. They like to get you back on a more regular basis. And I definitely will go back. They say I should do it every, I think, two to 3 years. I'm blown away at how well that came out. So I'm going to show a few different things of how they did that. I tried to get the people there to let me do the video while I was there. And of course they told me I had to get permission, and there were other patients that were there. So I couldn't film there. I thought it was going to be this big long production, and they did this great job of getting us in and getting us out. I'm going to put at least one of the major studies on the oxidized LDL with the fish oil down below, so you can look that up. I'm going to put the link to Lifeline down there. We're considering bringing it into our practice one day to offer it to our patients, because I really think it's an amazing opportunity. Everyone should have that done. If you find that you have 80% blockage in a carotid artery, wouldn't you rather have it treated then rather than wait for the stroke to occur, have debilitating disabilities occur, and then have them say, oh, well, we're going to go clean that out now? Why? Why isn't everybody having this done at a certain point in time? You know why? Because it costs money. And it's unfortunate that that's how our medical system works, but I think this makes a lot of sense. I hope you think it makes a lot of sense. And I hope you're still with me, because I think that was really good information. If you like what you saw, please hit that like button. Please consider subscribing. Until next time, take care.